A CNA removes gloves after providing care. What is the next required step to prevent infection? A. Adjust the resident's bed. B. Perform hand hygiene. C. Document the care. D. Leave the room. Answer B. Even after glove use, hands may be contaminated during removal. Performing proper hand hygiene immediately is essential to eliminate microorganisms and prevent cross-contamination between residents and surfaces. Which situation requires a CNA to use gloves? A. Talking to a resident. B. Feeding a resident. C. Contact with bodily fluids. D. Making an empty bed. Answer C. Gloves must be worn whenever there is potential exposure to blood, body fluids, mucous membranes, or non-intact skin to reduce infection transmission risk. What is the most effective method for reducing the spread of infection in healthcare settings? A. Wearing a mask. B. Using sanitizer occasionally. C. Proper hand hygiene. D. Cleaning floors. Answer C. Consistent and proper hand hygiene is the single most effective way to reduce healthcare-associated infections. When should a CNA perform hand hygiene during resident care? A. Before and after contact. B. Only after contact. C. Only before meals. D. At the end of shift. Answer A. Hand hygiene must be performed before and after every resident interaction to prevent the transfer of pathogens. What is the correct way to handle contaminated linens? A. Shake them before folding. B. Hold them close to uniform. C. Keep them away from the body. D. Place on bedside table. Answer C. Keeping soiled linens away from the body reduces the spread of microorganisms and protects the caregiver's clothing. Which action helps prevent contamination when removing gloves? A. Touch the outside surface. B. Remove quickly without care. C. Turn gloves inside out while removing. D. Reuse gloves. Answer C. Turning gloves inside out prevents contact with contaminated surfaces and reduces the risk of spreading pathogens. A CNA is caring for a resident with an infection. What is the best way to protect others? A. Ignore precautions. B. Follow standard precautions. C. Limit hand washing. D. Share equipment. Answer B. Standard precautions are designed to prevent infection transmission in all healthcare settings. When is it necessary to wear a mask? A. During all care. B. When risk of airborne exposure exists. C. Only during feeding. D. When documenting. Answer B. Masks are required when there is a risk of inhaling airborne pathogens or droplets. What should a CNA do after contact with a resident's blood? A. Continue care. B. Wash hands immediately. C. Sit down. D. Remove shoes. Answer B. Immediate hand hygiene is necessary after exposure to blood to reduce infection risk. Why should personal protective equipment, PPE, be used? A. For comfort. B. To prevent infection transmission. C. To save time. D. To improve appearance. Answer B. PPE acts as a barrier against infectious materials, protecting both the caregiver and the resident. Which item is considered PPE? A. Bed sheet. B. Gloves. C. Pillow. D. Blanket. Answer B. Gloves are a key component of PPE used to prevent contact with contaminants. When should hands be washed instead of using sanitizer? A. After touching clothes. B. When hands are visibly soiled. C. After talking. D. Before sitting. Answer B. Soap and water must be used when hands are visibly dirty or contaminated. What is the purpose of isolation precautions? A. To punish residents. B. To limit infection spread. C. To save time. D. To reduce staff. Answer B. Isolation precautions help contain infectious agents and protect others in the facility. What should be done with single-use PPE after use? A. Wash and reuse. B. Store for later. C. Dispose properly. D. Share with others. Answer C. Single-use PPE must be discarded to prevent contamination. What is cross-contamination? A. Cleaning surfaces. B. Transfer of microorganisms. C. Washing hands. D. Using PPE. Answer B. Cross-contamination occurs when harmful microorganisms are transferred between surfaces, people, or objects. What is the best way to prevent cross-contamination? A. Ignore cleaning. B. Perform proper hygiene. C. Share equipment. D. Avoid PPE. Answer B. Maintaining hygiene and using proper precautions reduces the spread of pathogens. What should a CNA do if exposed to infectious material? A. Ignore. B. Report immediately. C. Continue working. D. Leave facility. Answer B. Reporting ensures proper evaluation and follow-up care. When should gloves be changed? A. After each task. B. Once per shift. C. Only when torn. D. After meals. Answer A. Gloves must be changed between tasks and residents to prevent contamination. Why should hands be dried after washing? A. For comfort. B. To prevent skin damage. C. To reduce germ transfer. D. To save time. Answer C. Wet hands can transfer germs more easily than dry hands. What is the correct action after removing PPE? A. Leave immediately. B. Perform hand hygiene. C. Sit down. D. Eat food. Answer B. Hand hygiene is required after removing PPE to eliminate any remaining contaminants. What is the primary purpose of cleaning equipment? A. Appearance. B. Infection prevention. C. Comfort. D. Storage. Answer B. Proper cleaning reduces the spread of infectious agents. Which practice helps reduce infection risk during feeding? A. Sharing utensils. B. Hand hygiene before feeding. C. Feeding quickly. D. Skipping gloves. Answer B. Clean hands prevent contamination of food and reduce infection risk. When should a CNA avoid touching their face? A. During care. B. After break. C. At home. D. Before sleep. Answer A. Touching the face during care can transfer pathogens from hands to mucous membranes. What is the correct way to cough or sneeze? A. Into hands. B. Into elbow. C. Into air. D. Into clothing. Answer B. Using the elbow prevents contamination of hands and reduces spread. Why should nails be kept short? A. Appearance. B. Prevent germ buildup. C. Comfort. D. Style. Answer B. Short nails reduce areas where bacteria can accumulate. When is hand hygiene required after glove use? A. Never. B. Always. C. Sometimes. D. Rarely. Answer B. Gloves do not eliminate the need for hand hygiene. What is the safest way to dispose of contaminated waste? A. Regular trash. B. Proper biohazard container. C. Floor. D. Sink. Answer B. Biohazard containers are designed for safe disposal of infectious materials. Why should a CNA avoid reusing disposable items? A. Cost. B. Infection risk. C. Time. D. Comfort. Answer B. Reusing disposable items can spread pathogens. What should be done before putting on gloves? A. Wash hands. B. Sit down. C. Remove shoes. D. Eat. Answer A. Hand hygiene ensures clean hands before glove use. What is the main purpose of standard precautions? A. Save time. B. Prevent infection. C. Reduce workload. D. Increase speed. Answer B. Standard precautions are designed to minimize infection risks in all care situations. A CNA is about to assist a resident with wound care. What is the first infection control step? A. Put on gloves. B. Clean the wound. C. Perform hand hygiene. D. Apply dressing. Answer C. Hand hygiene must always be completed before any procedure, including wound care. It reduces the risk of introducing microorganisms into open areas of the body. Which action is most appropriate when handling a contaminated sharp object? A. Recap the needle. B. Dispose in a sharps container. C. Place in regular trash. D. Carry it carefully. Answer B. Sharps must be disposed of immediately in approved containers to prevent injury and exposure to infectious materials. What is the primary goal of using isolation precautions for a resident? A. Improve comfort. B. Limit spread of infection. C. Increase privacy. D. Reduce workload. Answer B. Isolation precautions are specifically designed to contain infectious agents and protect other residents and healthcare workers. A CNA notices their gloves are torn during care. What should they do immediately? A. Continue the task. B. Remove gloves and perform hand hygiene. C. Ignore the tear. D. Finish quickly. Answer B. Torn gloves compromise protection. Immediate removal and proper hand hygiene are necessary to maintain infection control. What is the correct method to prevent contamination when applying PPE? A. Put on gloves first. B. Follow proper sequence. C. Skip steps. D. Use only one item. Answer B. PPE must be applied in a specific order to ensure full protection and avoid contamination. Which practice reduces the risk of spreading infection between residents? A. Reusing equipment. B. Cleaning shared equipment. C. Skipping hygiene. D. Sharing supplies. Answer B. All shared equipment must be cleaned and disinfected between uses to prevent cross-contamination. When should a CNA perform hand hygiene during glove use? A. Before putting gloves on. B. After removing gloves. C. Both before and after. D. Only if dirty. Answer C. Hand hygiene is required both before donning gloves and after removing them to ensure complete protection. What is the most appropriate action if a CNA coughs during resident care? A. Continue care. B. Cover mouth and perform hand hygiene. C. Leave immediately. D. Ignore it. Answer B. Covering the mouth and cleaning hands reduces the spread of respiratory droplets. What is the purpose of using disinfectants on surfaces? A. Improve smell. B. Kill harmful microorganisms. C. Change appearance. D. Save time. Answer B. Disinfectants are used to eliminate pathogens on surfaces, reducing infection risk. Why is it important to avoid touching clean surfaces with contaminated gloves? A. Saves effort. B. Prevents spread of germs. C. Improves speed. D. Reduces cleaning. Answer B. Contaminated gloves can transfer pathogens to clean surfaces, increasing infection risk for others. Great job completing this practice. If you found this helpful, make sure to subscribe to Certify Edge for more exam-level questions. Drop your score in the comments, I'd love to see how you did. Keep improving, stay consistent, and I'll see you in the next video.